Hi, Ashley. I am Dr. Rinsdale, and I am going to do a physical examination on you today. Okay? Has anything been bothering you?
Just here for a checkup.
Okay, great. So I'm going to start out looking at your head. I'm going to take your sunglasses off. And I'm going to look at her head position. And I am going to look at the symmetry of her facial characteristics, and I'm not going to touch anything. I'm just doing observation. And now I'm also looking at the size and shape of her skull, and I'm looking at her hair patterns, and so far everything looks normal. And now what I'm going to do is just palpate for any lumps or bumps. I don't feel anything, so that's great. And I'm going to look at her neck, and I'm going to look at her trachea, and that looks like it is midline and center. Sometimes you'll have a little bit of deviation on some patients, but yours is nice and straight. And I am going to look at her muscles and look at the symmetry of her anterior and posterior triangles on both sides. And I am going to also look at the formation of her muscles in her neck, and all of that looks wonderful. And I'm looking at any skin folds in here as well, and those skin folds all look good as well. And I am going to now palpate her lymph nodes. I'm going to start out with the occipital. I'm going to come and do post-auricular, pre-auricular. I'm going to come down around here and do her submaxillary and her submental. And since I'm on the face, I'm going to come in and just take a peek at her parotid glands as well, and those all feel like there's nothing there. I'm going to come behind the sternocleidomastoid to look at her posterior cervical chain. I'm going to come in front of as well, and that's going to be her anterior cervical chain. I'm going to kind of come in through here because I want to look at the tonsillar as well. You actually got a little lymph node in there in your tonsillar. That's okay, that's the only one I felt though. Everything else has been good. I'm going to come here in the back, and I'm going to look 3 places on her clavicular area. I'm going to come here. I'm going to come to the infraclavicular or the chicken cutlet, and I'm going to come here. So I want to be on top of the clavicle, into the chicken cutlet, and behind, almost like you're giving somebody a back massage. All of those, all of those, all of those. When I'm doing the lymph nodes, I want to note if there's any redness, swelling, heat coming from those areas. And like I said, she's got 1 lymph node in her tonsillar area that's just, you can tell it's an older thing, like maybe a couple of weeks ago. Maybe you have a little sore throat or something. Okay, so it's working its way out, that lymph node. It doesn't feel like it's swollen right now. And in doing that, I'm comparing sides, okay, and making sure that everything is the same. So now what I'm going to do, I'm going to palpate her thyroid gland. I'm going to come over here. You swallow for me. And I'm watching as she swallows, and I want to come below that area. I'm sorry, I know I'm back to some people. She doesn't have swelling. She's got a nice normal sized thyroid gland in there that is just barely palpable. So, and no nodules. That's not tender for you, right, Ashley? Okay, great. And it is in the right place. It is not swollen, of a normal size. So I'm going to move on to eyes now. And the first thing I'm going to do is I'm going to look at her eyebrows and look at her eyelashes and just look at the shape and the color and condition of her eyebrows. And I'm going to look at her eyelids. Close your eyes for me. Perfect. And when I'm inspecting that, I am looking at, again, her eyelash position. I'm looking at if there's any lesions, obviously, on the eyelid. I'm looking at that she's able to open her eyes wide, which I can see she's doing that. I'm going to look at her conjunctiva and see what color they are. They're a little bit pink, pinky, orangey color. Her sclera are fine. Again, a little pink. Got a little allergies or anything going on? Not really. No, just your normal coloring. Okay. I'm looking for any discharge, so anything around the eyes, and I'm looking to see if there's any foreign bodies and your eyes aren't scratched or anything like that, right? Okay, so she probably doesn't have any foreign bodies. I'm going to ask you, let's turn a little so the camera can see what I'm doing. Turn just a little bit, okay. Follow my finger. Perfect, thank you. And I'm going to check your pupils. Okay, and I am looking at her pupil size are equal, sorry. Got her a little shined with the light. And then what I want to have you do is you would look at this paper and then look at the wall. So go from the paper to the wall. And I'm looking to see that her pupils also accommodate as well when she has to look far away and close. And that should be the ends of the eyes. So I'm going to go to the ears. And now I'm going to look at the size and shape and symmetry. So you noticed I looked at both ears because I'm looking for that. I'm looking at landmarks such as the tragus. I'm looking for the helix and all of that. And other than her having some piercings in there, everything looks normal. I'm looking to see the position on the head, which means I'm looking at the ears and the alignment of the ears to the eyebrows. And I want them to align, the top of the ears to align somewhere near the top of the eyebrows. And now I'm going to look at her auditory canals on both sides, see if I see any swelling or any irritation in that area that I can see, and everything looks nice and clear and clean. And then I am going to actually palpate in here, here, here. Tell me if it hurts with the piercings. Okay, they're all healed up, I guess. I'm also going to palpate in this mastoid area as well. Gotta find it, there it is.